Hello guys, we are from Medical Physics Group 1 and we're going to explain about medical physics application in the form of MRI, magnetic resonance imaging. Next. Yeah, allow me to introduce my members of group. There's Aswin, Lintang, Musa, Rahmi, myself, and Teddy. Next. So first thing first, what is magnetic resonance imaging? The magnetic resonance imaging, or MRI, is medical devices in the field of radiological diagnosis examination, which produce cross-sectional image recording of a human body organ by using a magnetic field. So basically, it can scan your body with the principle of nuclear physics. So it it uses electromagnetic field to detect the nuclei in your body. So basically that. Okay, next.
In this sector about medical physics use of MRI, our aim was to compare the extent of myeloma bone disease evaluated by radiodiagnostic method, conventional radiography X-ray, low-dose computed tomography LDCT, and magnetic resonance imaging MRI to select markers of bone metabolism and bone marrow microenvironment. So in MRI, there is almost there is no radiation at the diagnostic.
The basic principle of MRI, the structure of hydrogen, the hydrogen atom in the human body when outside the magnetic field has a random direction and does not form a balance. Then, when placed in an MRI device, then the atom hydrogen will be parallel to the direction of the magnetic field. Likewise, the direction spinning and precessing will be parallel to the direction of the magnetic field. When given a radio frequency, the hydrogen atom will absorb energy from that radio frequency. As a result, with the increase in energy, the hydrogen atom will experience a bend, while the amount of directional deflection is influenced by the size and duration of the radio frequency energy given. When the radio frequency is stopped, the hydrogen atom will align and again with the direction of the magnetic field. On this return, the hydrogen atom will emit the energy it has. Then the energy in the form of a signal is detected by a special detector and amplified. Then the computer will process and reconstruct the image based on the signal obtained from the various sites.
Okay, some of the functions of MRI are: an MRI scan is primarily useful for providing detailed image of organs, soft tissues, ligaments, and other features that are more difficult to see on CT scan. Procedures image with accurate temporal and spatial resolution can evaluate the anatomy and function of the cardiac, and the field of tomography is not limited. MRI results, in addition to being diagnostic evidence, can also help determine management and demonstrate the patient's prognosis. Next. The advantages of MRI when compared to other equipment are that the resulting image is clear and can be seen from various sites without the use of radiation, provides results without the need to change the patient's position, and does not use contrast for MRI examination. MRI creates image that can show very clear difference and is more sensitive to access the anatomy of the soft tissues in the body, especially the brain, spinal cord, and nervous system compared to ordinary X-ray and CT scan.
The component of MRI. In the first is the magnet. The main magnet of the MRI plane consists of three types, namely permanent magnet, are made of material very magnetic and can generate field magnet up to 0.3 Tesla. Resistive magnet detects magnetic field started between 0.02 until 0.4 Tesla. Superconducting magnet generate field state up to 4 Tesla. The additional magnet in the form of SIM coil, generate foil, and F coil. Gradient coil. Gradient coil product field gradient magnet that can be traceable, in which the magnetic field can be made directed on the X, Y, and Z axis. Using the X, Y, and Z direction for the need for pulse sequence and localization selection rate at the anatomical slice of the body. Next, SIM coil. SIM coil function to make a magnetic field homogeneous. RF coil. The RF coil are located within the magnet assembly and relatively close to the body of patient. Radio frequency FF coil are two types of coil. The name transmitter and receiver. More function similar to an antenna. Size of self-adjust to the object examined. A radio frequency coil transmits a radio signal to the body part to test by the coil receiver. The RF signal will be detected and returned. RF detector. Radio frequency RF detector are two types of coil, the name linear analog detector and quadrature analog detector. Linear analog detector produces only the M X accent or the MY accent. Magnetization as the signal as a function of time. Quadrature analog detectors separate the MX accent and MY accent signal coming from the RF coil. RF polarization. The RF system can operate either in a linear or circular polarization mode. In the circular polarization mode, quadratic coil are used. Quadratic coil consists of two coils with a 90-degree separation. This produces but improve excitation efficiency by producing the same effect with a half of the RF energy, helping to the patient and a better signal to loss ratio for the received signal. RF shielding. RF shielding function to make RF signal can enter electrically conductive enclosure. This is because RF energy that may be in the environment can be picked up by the receiver and interfere with the production of the high quality image. Oversampling is digitalization of the time domain signal at a frequency much greater than necessary to record the desired field of view. Digital filtering is the removal of the select band of frequency from a signal. For example of filtering, consider the following frequency of the main signal. Computer. Computer is a component used to process signal, store data, and display the resultant image.
The difference between MRI and other medical physics tools. From the, from the side of the scope, MRI examination is carried out on the brain, spinal cord, heart, blood vessels, breast, bones, and joints, and other internal organs. The scope of CT scan examination are performed on the area of the chest, abdomen, urinary tract, pelvis, legs, head, and spine. From the side of scope of X-ray are often used to see the presence or absence of fractures and see pictures of a person's chest. From the side of cost, MRI relatively more expensive, CT scan relatively cheaper, and X-ray practically cheaper. From the side of the device used, MRI using a large magnetic field and radio frequency waves.
Apa siapa sih ngabisin itu?
Thus, the operation use of X-rays
Oh,
or radio material. During an MRI examination, it allows molecules in the body to move and to form signals. The CT scan tool is an X-ray generator which, when operated by the operator, will emit X-ray in a certain amount and time. The X-rays will pass through the body's tissues and the examined and captured by the detector. The device use of X-ray is the administration of a small dose of ionizing radiation to the body to produce an image of the inner body in conventional X-ray are taking image of an object using X-rays. From the side, the risk of harm. MRI tends to be safer than a CT scan because an MRI scan does not use X-ray radiation in the process. This means that people who are prone to radiation risk, such as a pregnant woman, can undergo an MRI. The risk of harm of CT scan. A CT scan, on average, can increase the chance of fatal cancer by 1 in 200. This figure means that when compared to the natural incidence of fatal cancer in the United States, it is 1 in 5. CT scan in children can triple the risk of brain cancer and leukemia, especially when given to the stomach and chest at certain dose. The risk of harm of X-ray ex- exposure to high levels of radiation can have various effects such as vomiting, bleeding, fainting, and loss of skin and hair. The examination process of MRI. MRI painless and non-invasive and tends to be noisy, takes longer, and has the potential to cause claustrophobia, an anxiety about being in a closed engineer room. The examination process of CT scan. CT scan and MRI scan are both painless and non-invasive. The examination process of X-ray. The object to be observed will be illuminated with X-ray and behind it is placed a film to capture the resulting image.
How does magnetic resonance imaging depict image? MRI can be described as follows: when the patient body positioned in a strong magnetic field, the body's hydrogen cores will direction and rotate around the direction or vector of the magnetic field. When the signal radio frequency emitted through the body, some hydrogen nuclei will absorb the energy from that radio frequency and change direction, or in other words, resonate. When the radio frequency signal discontinue, the cores will return to their original position, release energy that has been absorbed, and creates a signal that is captured by the antenna and processed by the computer in a form radiograph.
The two picture on this slide is result of an MRI scan. In picture left chest, we can conclude that MRI can show head, bone, and lungs. And in left, we can conclude that MRI can show vessel.
Okay, So, what are the procedures to watch out from MRI? The increase in scope of MRI application means that radiographers have extended their roles to incorporate advanced techniques. The radiographer's core skills enable new and advanced techniques to be implemented effectively and efficiently for improved patient outcomes. So, about the procedure, the technical procedures may not be explained in detail in this section, but what we need to be considered is who is responsible for implementing the procedure MRI mostly in Indonesia. Mostly, responsible person is the radiographer, while those who plan MRI is the medical physicist and the doctor.
Okay, what are the different types of MRI examination? Okay, actually, there's a lot of examination out there, but we're gonna explain 6 of them. And the first one is abdomen MRI. So DWI is stand for diffusion weighted imaging in the abdomen and of pelvis is a valuable adjunct and to traditional techniques and improve the sensitivity of MRI for lesion detection, especially in metastasis. DWI may be implemented as routine sequence in stand abdominal MRI protocols and considers of the most value when IV contrast again cannot be administered. So it's basically it can scan through your stomach, kind of something like that, and it can diagnose such as like cancer, tumors, or okay. Next one is brain MRI. It's play huge. It play important role in neuroscience and experimental medicine. The amount of data produced by imaging increasingly exceed the capacity of expert visual analysis, resulting in a growing need for automated image analysis, in particular, accurate and reliable method for segmentation. Classifying image region are the key requirement for the extraction of information from the image. Yeah, it's kind of work like same of any examination, but it scan your brain literally. Okay, next, breast MRI. It actually can scan inside your breast, especially in a woman, to diagnose such as breast cancer and other disease that require immediate treatment. The patient will know malignancies. Imaging help in the preoperative staging, subsequent choice of appropriate therapy, either surgical or medical, and patient will know malignancies that are initially treated medically with neoadjuvant chemotherapy. Imaging is performed in a symptomatic woman to detect breast cancer in its early stage. Imaging may be used to evaluate foreign body within the breast. Next one is cardiac MRI. So it's basically same like as abdomen MRI, but it can scan through your cardiac or heart. It can detect such as it provide important information for diagnosis and treatment of cardiovascular disease by enabling quantitative assessment of a functional parameters such as motion, wall thickness, and ejection fraction. It can diagnose such as like coronary heart disease, something like that. Next one is magnetic resonance venography. Uh, it basically scans through your vena or maybe blood vessel. Yeah, the venous system is rarely imaged using traditional TOF or phase contrast techniques. However, the pressure of extremely slow blood flow, very tortuous, and veins or small, tortuous collateral significantly limit this method. Additionally, an image the upper extremely and central veins. Several acquisition may be necessary because the subclavian vein course perpendicular to the extremities and the direction of flow in the superior vena cava (SVC). Its opposite that of the arm, with the patient arm at the side. Even without this issue, TOF MR venography or MRF can be very consuming. 3D contrast enhanced MRV remediate this issue. Yeah, and the last one is MRA, or magnetic resonance angiography. Uh, it can scan through your angiography, like could play a central role in diagnosis in cranial GCA and diagnosis and monitoring large vessel. An MRA of the aorta, its major branches should include vessel from the carotid bifurcation to the iliac arteries and coronal acquisition to include the axillary and brachial arteries. The it's the same like the full your full body.
Okay, next is magnetic resonance imaging safety. The first one is main magnetic field. In order to prevent accident caused by projectile, all equipment brought to the scanning room, such as anesthetic trolleys, wheelchairs, and patient trolley, must be ensured to be non-ferromagnetic. The installation of a metal detector, which everybody has to pass through before entering the MR suite, is highly recommended. It is also advisable that all nursing, housekeeping, fire department, emergency, and MR personnel be educated to the potential risks and hazard of the static magnetic field. Signs should be posted to prevent possible entry into the scan room with ferromagnetic objects. Constant education of everybody involved is also vital. It is essential that every individual involved with MR have a true understanding of the possibility of danger of. And the second one is time-varying magnetic fields. In order to reduce the acoustic noise caused by the gradient field, the use of earplug of headphone, ear defender, or other means of hearing protection is highly recommended. A reduction of acoustic noise levels may also be achieved by decreasing the level of gradient pulsing in an imaging sequence. And the third is radio frequency field. In MR exposure up to 1 hour, the total body exposure should be limited to a total energy deposition of 120 watt mean every kilogram in order not to overload the thermoregulatory system. To protect poorly perfused tissue such as the eye, the tissue should not be exposed to a local SAR of more than 10 watt every kilogram, average over 0.01 kilogram for more than 10 minutes. For exposure of infants, pregnant women, or persons with cardiocirculatory and/or cerebral vascular impairment, a reduction of these values by a factor of 2 is recommended. For an RF-emitting surface coil, the average should be taken over the volume affected by the coil. When utilizing surface coils, the operator must be careful to prevent any electrically conductive material form a conductive loop with itself or with the patient. Tissue or clothing could potentially be ignited by uninsulated cables. Coupling of a transmitting coil to a receive coil may also cause severe thermal injury.
Magnetic resonance imaging cost, and where is magnetic resonance imaging available in Indonesia? At this time, MRI available in several cities in Indonesia, such as Bogor, Jakarta, Yogyakarta, Surabaya, Makassar, Medan, Semarang, and Tangerang. And the cost is variety from 1 to 3 millions. Maybe this cost is a little more expensive than treatment using CT scan and X-ray, and currently still not all hospitals have it.
The advantage of using MRI compared to endoscopic imaging tools there are many, one of which is the ability to display details anatomy clearly in multiple sections without altering position of the patient. In addition, the imaging results produced by MRI are clear and can be seen from various sites without involving the use of radiation, give result without the need to change the position of the patient, do not use construct for most MRI examination. Fully equipped MRI facilities with the ability to dynamically access the function of certain organs, to access blood distribution both in the brain and in heart, and see the metabolism that is inside a tumor. Among the non-ionizing technique, the advantage of MRI over the US includes multiplanar imaging ability, comprehensive assessment of the entire gastrointestinal tract, and easier follow-up of disease with MRI image. The ability to distinguish fibrotic from inflammatory strictures and high sensitivity for detecting absence and fistulae are the other important advance. Next. Advantage.
Okay.
Ya, apa lagi?
Next is what are the effects of frequency on MRI? The first one is effects of static magnetic field. A document of the World Health Organization states that there is no evidence on the short and long-term adverse effect of the MRI static magnetic field on human health. This statement has been confirmed also more recently, considering the increased use of MR scanners with the higher static magnetic field values. There is an urgent need to perform studies to provide assurance about their safety. The biological effect of static magnetic field is one of the most controversial topics in the field of MR safety. It has been reported in several literature that several structures within humans are affected by the static magnetic fields, such as the retina, pineal gland, and some cells in the paranasal sinus. However, the effects are not the same as harmful or teratogenic or carcinogenic. The second one is effect of gradient magnetic field. During an MRI examination, the gradient magnetic field, which serve for the spatial localization in the image reconstruction process, is often switched on and off. For this reason, they are considered time-varying magnetic fields ranging between ELF and EF and IF. Most of the available studies deal with the possible association between residential ELF and cancer. ELF-MF has been classified in Group 2B, possibly carcinogenic to humans, due to the possible association between residential magnetic fields and childhood leukemia. Furthermore, a decreased survival of children with leukemia after exposure to ELF magnetic fields has been observed, while no correlation has been established between ELF field exposure and breast cancer risk. The time variation induced in the patient undergoing a MR scan an electric field which could stimulate nerve and muscle, and could generate cardiac stimulation or even ventricular fibrillation. While the latter is primary concern, being a life-threatening condition, possible peripheral nerve stimulation may cause discomfort and could not be tolerated by the subject, thus interfering with the examination or would result in request to stop the examination. And the third is effect of RF fields. Interaction between RF and biological tissue during MR procedures could be unsafe for patients. Most of the report accidents are burns due to hot spot in presence of conducting material close to the patient, such as the lack of physiological parameters, heart rate, blood pressure, oxygen saturation, and temperature monitoring equipment. This kind of risk can be more serious in the case of internal biomedical implants, especially for implants that have elongate configuration and/or are electronically activated. MRI-generated RF are unlikely to be genotoxic, but unfortunately, to date, no epidemiological studies are available to assess possible long-term health effects due to this radiation. And the last, effect of combination statics, gradient, and RF fields during MRI scan. During our MRI scan, patients are exposed to combination of static, gradient, and RF fields, besides minor adverse events such as nausea and rare allergic reaction or tissue necrosis associated with containing gadolinium. Contrast again used routinely for MR examination. More relevant for human health are the effects on biological parameters. Unluckily, very few works deal with the biological effect due to the simultaneous exposure to the three types of magnetic fields.
Okay, the conclusion is MRI is a medical device in the field of radiological diagnostic examination with the techniques used to produce image of organs in living organisms through pathology and changes in motion psychology. MRI image capture using hydrogen core and magnetic field. The image quality obtained by MRI is usually better resolution than other radiological tools, but with the cost of using MRI, which is relatively more expensive than the other radiological tools. The imaging result produced by MRI are clearer than and can be seen from various sides without involving the use of radiation, provide result without the need of change the patient's position. Do not use contrast for the most MRI examination. However, under certain examination, MRI will cause noise, and scanning using a closed MRI will cause discomfort in patient with claustrophobia. The effect of MRI as a medical tool today do not pose a danger to the potential who see it. This is because the radio frequencies principle of MRI with a strong magnetic field, unlike CT scan, which use X-ray radiation. And that's all from us. Thank you for listening. I hope you all understand, and we're sorry for all the mistakes. We're open for the critics and we'll keep improving. That's all. Thank you. Thank you very much.